Hello and welcome. I'm Dr. Sánchez, and today we're going to talk about a topic that generates a lot of curiosity, anxiety, and unfortunately, misinformation. Penis size. What's considered normal and how to measure it correctly, both length and girth. This subject, which was once almost a taboo, has become increasingly common in medical offices, online forums, and social media, especially with the rise in male cosmetic procedures. Before we continue, I want to reassure you with something that might surprise you. Around 95% of men who worry about their penis size are actually within the medically normal range. Yes, you heard that right. In most cases, it's not a physical issue, but a distorted perception of the body. Many men feel insecure due to unrealistic comparisons, especially with the standards shown in adult films or on the internet, where bodies are often exaggerated or even digitally edited. Here's another interesting fact. This concern is much more common among men than among women. While over 50% of men report feeling anxious or dissatisfied with their size, only 5 to 10% of women consider penis size to be a very important factor in their partner. So, take a deep breath. My goal in this video is to educate you, inform you, and above all, help you gain a clearer, more realistic perspective. We're going to review real scientific data. You'll learn how to measure your penis correctly, understand the procedures for increasing its size and their risks, and even explore a historical curiosity that might change how you view this topic. Let's start by understanding how penis size is actually measured, since this is essential for knowing what's considered normal. There are two main dimensions to consider: length and girth, also known as the circumference or perimeter of the shaft. How do you measure length? It can be measured either erect or in a flaccid, stretched state. Both methods are used in scientific studies, but the most reliable from a clinical standpoint is stretched flaccid length, as it correlates very well with erect length. Now, I'll explain how to do it correctly. First, use a ruler or measuring tape. Second, place it against the pubic bone, right where the penis meets the body. It may be necessary to press lightly on the fat to reach the bone. Third, stretch the penis outward without forcing it, but firmly, and measure to the tip of the glans. If you're measuring erect, do it the same way, from the pubic bone to the tip, keeping the ruler aligned with the shaft. It's important to avoid measuring from the skin or underneath the penis, as that adds length and gives inaccurate results. How do you measure circumference or girth? This is also crucial and varies greatly between individuals. First, take a flexible measuring tape or string. Second, wrap it around the midsection of the penis, not too close to the base or the tip. Third, mark and record the measurement. You can do this in either flaccid or erect state, though most studies are based on the erect measurement. Many men overestimate or underestimate their size due to incorrect measuring methods or comparisons with others in different states, which leads to unrealistic expectations. Now that we know how to measure correctly, let's see what the scientific data says. A large-scale scientific review analyzed data from nearly 15,000 men worldwide. This type of analysis, called a meta-analysis, combines multiple studies to obtain reliable averages. For average length, when measured erect or in stretched flaccid state, 90 to 95% of men fall within a range of 10 to 16 centimeters, that is, 4 to 6.3 inches. The global average is approximately 13.2 centimeters, a little over 5 inches. This means that if you're within this range, you're part of the vast majority. At the extremes, medical terms are used. Micropenis is diagnosed when stretched length is less than 7.5 centimeters, about 3 inches. On the other hand, an extremely rare macropenis is defined as greater than 24 centimeters, or 9 inches. As for average circumference, it also varies but follows a common pattern. In stretched flaccid state, it's between 8 and 10.5 centimeters, that is, 3 to 4 inches. Erect, it's between 10 and 13 centimeters, or 4 to 5 inches, with an average of 11.5 centimeters. So, when someone mentions an average size, these are the real numbers. The problem is that many people make comparisons to unrealistic standards, especially with the adult entertainment industry, where actors are selected for unusual sizes and camera angles or edits are used to exaggerate perceptions even further. The message is clear. If you're within these ranges, you're in the absolute majority. And if you're outside them, that doesn't define your health, attractiveness, or masculinity. Now that we understand what's considered a normal size based on scientific evidence, let's address the question many men ask silently. Is there a safe and effective way to increase penis size? First, I want to clarify something very important. It's completely normal to be curious about this topic. We live in a society that constantly bombards men with unrealistic expectations about their bodies. But if you're thinking about intervening in something as delicate as your anatomy, it's essential to have accurate information. Because yes, there are procedures that promise results, but not all are safe or necessary. One of the most common methods for increasing girth is hyaluronic acid injections. This substance, which naturally exists in our bodies and is used in facial aesthetic treatments, can temporarily increase penis girth by 2 to 3 centimeters. Its effects typically last 12 to 18 months and are gradually absorbed by the body. This method is relatively safe, as long as it's performed by a competent professional using approved products. But, an important warning, not all injectable materials are safe. Some centers offer non-absorbable fillers like PMMA or industrial silicone, which can cause nodules, infections, chronic inflammation, deformities, and irreversible damage. For that reason, these substances are never recommended. As for penis lengthening, the options are more limited and riskier. There are two common procedures. One is pubic liposuction, which removes fat at the base of the penis to make it appear longer, but it doesn't change the actual length of the organ. It just improves visibility. The other involves cutting the suspensory ligament that attaches the penis to the pubis, allowing the organ to drop forward and appear longer at rest. However, it doesn't increase erect length and can cause instability during sex, along with high risks of complications, scarring, and postoperative frustration. For this reason, both the World Health Organization and various international medical associations do not recommend these procedures as a first option. In many cases, the aesthetic benefits don't outweigh the physical and emotional risks. I also want to clear up something that causes confusion: penile implants. Despite being promoted online as size enhancement solutions, they are actually designed to treat severe erectile dysfunction, not for aesthetic reasons. They are medical devices used only when other therapies have failed. If you're considering doing something about it, the best tool you have is honest medical information. It's worth reflecting on why you want to change. Is it for yourself, or due to external comparisons that may lack foundation? To wrap up, I want to share a cultural story that might shift your perspective. In ancient Greece, the male ideal wasn't associated with a large penis. On the contrary, wise, strong, and admired men were depicted with small penises, symbolizing self-control, rationality, and virtue. Large penises, meanwhile, were linked to excess and vulgarity, and were reserved for comedy or caricature. What this teaches us is that standards of beauty and masculinity change with time and culture. What is promoted as desirable today might have been considered the opposite in another era. So, why let something so variable define your self-esteem? The truth is that most anxieties about size aren't based on medical facts, but on social pressures, pornography, and misinformation. What's important isn't meeting an external ideal, but having a healthy relationship with your body and sexuality. Size doesn't determine your attractiveness or ability to give or receive pleasure. What truly matters is how you feel about yourself, how you care for your health, your active communication with your partner, and the respect you have for yourself and others. If this information has helped you see things more clearly, I invite you to subscribe to our channel for more real content on men's health, aimed at breaking myths, raising awareness, fostering empathy, and promoting honesty. Thanks for joining me until the end.